Why?
Okay.
Oh, go
There we
ahead.
go. Okay. So this is Advocacy by Erin Hodges and Vanessa Art. Okay, what is advocacy? Healthcare advocacy is a broad term, but essentially it is encouraging and implementing patient-centered care for everyone. A lot of what we consider part of basic patient and client care is the result of advocacy work. And two examples are the Whole House and Children's Bureau. Both of these organizations were responsible for bringing about social change for improving care for underprivileged European immigrants in 1893. And then the other one is National Welfare Rights Organization, or NWRO, and they were the first to propose a patient bill of rights. And that has since been incorporated into JCAHO's accrediting standards for hospitals. Most people in groups that align themselves and become members of advocacy organizations are patient-centered. The history of healthcare advocacy is long, with well-organized groups forming in the late 19th century and are still prevalent today. Some of these organizations work one-on-one with individual clients, while others work with large organizations to promote health and access to healthcare. The types of advocacy organizations include a healthcare advocate that works for an institution is employed by the facility that they work for. Their responsibilities would be to communicate patient care during and after treatment, thereby ensuring patient satisfaction and minimizing remittance. And then second would be for-profit health advocates, for-profit health advocates, and they're usually employed by a larger entity, and they are like the middleman. For example, health insurance agents that sell private health insurance. Nonprofit they typically work for government on the federal, state, city, and community levels. They also might work for advocacy agencies that specialize in specific illnesses or diseases, for example, cancer and heart disease. And then there's private, and these are individual consultants that work independently for hire by the patient. Advocacy, examples of advocacy organizations are the National Association of Healthcare Advocacy and National Patient Advocate Foundation.
Okay, so these two examples, first, the National Association of Healthcare Advocacy Consultants, they have two main priorities, and those are first, to assist the public in learning how to navigate through healthcare situations, and second, provide education to professionals to enhance skills needed to excel in advocacy. And this association is open to the general public, so really anybody could join. And to become a member, all you have to do is apply on their website. And if you do become a member, those perks include networking opportunities, access to a national database of people doing healthcare advocacy work as well, so you can stay up to date, and participation in the development of ethical standards and best practices for the profession. And then the second one, National Patient Advocate Foundation, their mission statement said, "We represent the patient's voice nationwide, particularly those struggling with a chronic, debilitating, or life-threatening illness." So they really kind of stand for what advocacy is, which is the patient's voice. And so National Patient Advocate Foundation supports sensible reforms that will expand access to healthcare for patients and protect them from the often unjust and discriminatory effects of the illness. And this is a more volunteer organization. So again, anyone can get involved, and all you have to do is register on their website. So what would happen without advocates? This is just one example, but without medical billing advocacy groups, billing offices would run amok. more patients would pay for medical bill charges that are inaccurate. They would pay for treatments they didn't receive, operating room time that wasn't used, or pay providers they didn't even see. These instances are already happening, but because of billing advocacy groups, the providers are getting caught, errors are being corrected, and erroneous charges are being overturned. And this actually happened to my grandma. She saved a lot of money thanks to an advocacy group. So that's one thing that happened within my family that was pretty cool. So the other one is the second is a professional organization. And these organizations are formed and organized to promote the development and education of a specific profession. People that would align themselves with professional organizations are interested in protecting and promoting the healthcare professionals. As a healthcare professional, benefits would include furthering education, leadership training, networking, and employment opportunities. The professionals themselves make up the organizations. And then professional organizations are also a crucial component of the legislative process as they seek to develop and implement sound public policy.
Okay, examples of professional organizations are the American Medical Students Association, Physicians Alliance of America, and Families USA. This is American Medical Student Association, and they have 4 main priorities. First is the quality, affordable health care for all. Second, global health equity. 3, enriching medicine through diversity. 4, professional integrity, development, and student well-being. Physicians in training. This association is a great network developed to help students through medical school, but the core of their mission is advocacy. Members include medical students, pre-medical students, interns, residents, and practicing physicians. You can join through their website. And then how is AMSA beneficial for me? And it is to build a professional network, take action on current issues, attend seminars, institutes, and national conferences, and saves money on a diversity of products and services. And then the next one is the National Physicians Alliance. The National Physicians Alliance focuses on improving health and well-being and works to ensure equitable, affordable, high-quality care for all people. And what do they have to offer? For medical students progressing toward graduation, NPA allows access to their database for free to all medical students progressing toward graduation. With this access, you can follow all their work and current issues, participate in activities, and start networking. The actual organization is a collection of doctors that hold an MD or DO degree. When you have achieved one of the above, you can become a voting member. And then Families USA. Families USA works hard to achieve high quality, comprehensive, and affordable health care for all Americans. Through Families USA, you can become a member of the Health Action Network. The HAN helps healthcare advocates from across the country stay connected, informed, and engaged on key health policy issues and advocacy strategies. Anyone can become a member of this organization. Included in their membership is email updates, webinars, conference calls to provide learning and collaboration opportunities for healthcare advocates and policy experts. They also offer annual conferences.
Okay, and this is just one example of how Family USA helps students is they have emerging professionals, and it's a group. It's a networking group of newer and younger leaders within the health policy and advocacy community. And advocacy and a professional function. Many of these advocacy groups take part in legislation. For example, Family USA is an influential advocate in Washington, D.C. They played a major role in almost every piece of healthcare legislation. They are one of the leaders of a national campaign to persuade states to expand Medicaid under the Affordable Care Act. An individual healthcare professional can belong to either an advocacy or professional organization. There's a definite possibility that a healthcare professional, such as a physician, nurse, health educator, or etc., would want to associate themselves within an advocacy organization, patient-centered entity. Such professionals would feel passionate in influencing social and political change. If they worked privately, there are also advocacy groups that match clients with advocates. Both types of organizations, advocacy and professional, can be not-for-profit and for-profit. And that is advocacy.
Awesome. Great work, both of you. Covered the topic really well, really what we were trying to get to. Now, I do have a question for you about advocacy organizations, and I know we didn't spell it out very well in the question, but did you guys learn anything about like advocacy organizations for like for-profit entities? Like, well, I'll just tell you an example that you guys need to know for the test going forward. A for-profit advocacy group for for-profit hospitals is the Federation of American Hospitals. I think we know that acronym. And then also for not-for-profit hospitals, we have there's an advocacy group called the American Hospital Association. That comes up on the quizzes, and just so you're aware. I know we didn't line that very well in the question, so you don't know me on that. I just want to make sure. The question for each of you, we'll start with Aaron and then Vanessa, just follow up with the question. What was the most interesting thing that you learned while you were studying this topic?
For me, the most interesting thing was how much effect these groups have. Just the Families USA was the group that stood out the most to me and really kind of made me want to join their group. It was just really awesome, everything that they do, and just how much impact that they've had within legislation, and I guess how much weight they have. I don't know how else to explain it, but yeah, that was just really awesome to me.
Great, thank you. Vanessa?
Well, I come from, just I'm a public health major, and so I've studied like sociology and psychology, and so a lot of these things that we've studied already or that I've studied have come about because of advocacy, and that's what really was very impressive to me, is just that they're just people feeling passionate about wanting to, especially just the advocacy groups, and that they have such a long history. A lot of what we consider being, we consider just part of everyday basic human rights is enforced because of advocacy groups. I find that really inspiring. And then I also learned that because advocacy, there's such a need for advocacy in our society now with the healthcare changing, is that hopefully there will be professional degrees that come about. There's some master's programs that are apparently new that you can get in advocacy in healthcare, and hopefully beyond that. So hopefully it's more than, in the future, it's more than just saying that you're an advocate.
Awesome. Yeah, great points from both of you. Yeah, advocacy is definitely a very interesting aspect of the healthcare industry. And as you've mentioned, a very important integral part. Yeah, Aaron, you mentioned that your grandma was an advocate, so that's fantastic that you were able to understand that a little bit more.
Mm-hmm.
All right, so I'm going to stop recording now, but stay on for a sec.